So a pinched nerve in the neck would typically present not just with neck pain, but typically pain that tends to start in the neck but radiates down through the shoulder and into the arms. This pain may also be associated with numbness or tingling of a particular nerve that's pinched, and can even cause weakness of the arm. We tend to diagnose this problem by doing a thorough history and physical examination, determining the extent of the nerve damage and if there is the need to seek surgical attention sooner rather than later. Depending on the severity of the pinched nerve, the initial treatment for something like that would include some physical therapy after diagnosing the issue. An MRI of the cervical spine is typically necessary to determine the extent of the pinched nerve and the extent of the degenerative joint or disc changes. Once the diagnostic workup has been completed, we try to see if there is an actual neurologic deficit, and if so, the patient may need surgical treatment. But oftentimes we are able to achieve very good outcomes for pain related to a pinched nerve in the neck by utilizing epidural steroid injections and selective nerve blocks, which are X-ray guided procedures, along with physical therapy and medications. Everyone has pain. Pain, of course, is a protective function of the body, where it helps us move away from a stimulus which can potentially be harmful for us and life-threatening. And that is the purpose of acute pain. There is a rare condition where a person does not feel pain, and in fact it is associated with a shorter lifespan because pain is protective for us. What is chronic pain? And a lot of textbooks and people describe pain when it's over the duration of 2 months, and some people say 3 months. You can call it chronic pain. But really, to differentiate acute from chronic pain is when there is an actual recovery taking place in the body, or there's healing in a joint or healing at a surgical site. It's more acute pain. But any pain that outlasts the duration of that actual healing process, and there's no actual recovery taking place, but the pain is persistent, can be called chronic pain. And when pain like this becomes chronic, it can really affect how we function in our day-to-day life, and can take a toll on our mood and day-to-day living, and it needs to be treated.